Napabustan, a field reporter and a participant in several beauty pageants. In 2017, I won Miss Silka Pampanga, and in 2018, I was crowned as first ever Queen Mabalacat City. And in the same year, I also won second runner-up in Mutianing, Kapampangan. CSA, sa mga friends ko, kasi Doc Contessa, sobrang famous niya when it comes to non-surgical procedures. Kaya ayun, sa mga friends ko na nagawan niya na. Painless. Kaya non-surgical was okay for me. Today I am here at CSA DERM CENTRE because Doc Contessa will help me with my concern, which is my eye area. Because although I have enough sleep, I always wake up with tired-looking eyes. Kaya excited ako na mawala yung dark circles and yung fine lines ko to look good and feel better. Don't forget to like and subscribe and hit the notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll talk about the use of PDO threads for dark circles. And we also have right now a new guest. Let's all welcome Miss Kim Liana. Hi Kim.
Hi everyone. Hi,
Right.
Doc.
Kim is just 23
years
old with the concern of like sunken under eye, hollow under eye, dark circles, right?
Yes po.
Yan. And she was sharing a while ago, I think it's like also lifestyle. Lack of sleep, overwork,
Yes po.
from studies, from
Work.
work. There you go. So, because actually it's a common problem. Like in my center right now, I get a lot of clients coming to me, Doc, my problem, under eye. Yan, I look tired, stressed, haggard. Those are common concerns nowadays, okay? Because right now, people are busy going back to work, okay? Of course, we still have to continue working. And the eye area, nowadays, actually, there was really an increase, especially when people were using face masks and they always see the eye area, the eye region. Or during the time that there was a lot of Zoom conferences, they see your eye area. So, the concern of having this tired eye or like haggard look, commonly talaga it's the lack of sleep, the over fatigue, or the being overstressed. That's the common cause, okay? But for some people, it's like from genetics. Some people already were born with like sunken under eye, okay? Or their, what is their ethnicity? Because we see some people na talagang born with sunken under eye. And others naman, I was sharing with Kim a while ago, some people with medical conditions like allergic rhinitis, urticaria, hypersensitivity, they're prone to having dark circles also. Like if you have a history of that na every morning you're sneezing, or yung kinds of like allergies, you are also prone to having dark circles. And others, aging. Let's not forget also the aging. Aging also is one of the reasons why we're having this problem under eye: volume loss, collagen depletion, mga depletion ng hyaluronic, elastin. Yan. Aging is another factor and also a common cause of under eye problems. And other past procedures, probably others had surgical procedure in the eye area or any other medical conditions. Yan. Because some people are asking me, Doc, what's causing this? Why do I have like this? Yan. And others are asking, Kim, how do I prevent? Yan, prevention naman. They're asking, how do I prevent? Of course, correct the lifestyle. Adequate sleep, adequate nutrition, skincare around the eye area, right? It's okay to apply those vitamin C, vitamin K, and any eye cream, or some are putting like tea bags or cucumber. You can do that. Nothing's wrong with that. Proper hydration. Yeah. So those are means to also prevent that. Okay. And of course, skincare is important, and applying some topical skin nutrients there will also help. Okay. Genetics medyo ano na eh.
Mahirap po kahit anong gawin eh. No?
Yeah. But there's a way, like a medical and a surgical way to improve those. And that's why we are here. Kim is here so that we can do some management for her concerns. Kasi nga, she's noticing na as time passes by, the more it becomes sunken, and she's noticing already pigmentation under the eye area. That was my problem too when I was a medical student, okay? So for Kim, actually, we've done in the past a procedure called dermal filler for Kim already. So we had injected a hyaluronic substance in the skin tissue layer in the infraorbital region. For today, what we're going to do for Kim is to use those PDO threads, absorbable types of threads, for the correction of this hollowness under eye. So they can also be for volumization, they can be for skin brightening, and also like restore collagen, elastin, rejuvenation. That's our treatment for now. Okay? Yeah. I'm so starstruck by Kim. She's so pretty po. Actually, she's Miss Mabalacat
2018.
Yeah. Okay. We'll show the treatment when CSA Medical Aesthetics return. And we're back. So we're with Kim. So we're treating the under eye region. So the infraorbital section is the lower eyelid part up to this line here, the so-called orbital rim here. That's usually where we target our treatment for those hollow, sunken under eye or the so-called dark circles. So if you look at her under eye region, there's a noticeable also presence of a tear trough which extends in the mid-pupillary line. And because of that tear trough, it creates that kind of shadowing effect, creating that pigmentation or a dark circle-like effect. Okay, so Kim, that's also your concern, right? So parang nangingitim yung under eye region, okay? So we mentioned a while ago, possible causes also yung starting collagen depletion, elastin depletion, volume loss, tsaka in your case kasi sa type of work mo, probably you lack hours of sleep, okay? So in the past, we already did the so-called injection of hyaluronic dermal filler. That's also one of the treatments that we do for the under eye, sunken under eye, or also dark circles. We fill in with hyaluronic because our skin also needs that type of molecule, the so-called hyaluronic, to also attract water, restore volume. Right now, what we need to do is also restore the skin's elasticity. So how do we check on the skin's elasticity? We do like a pinch test like that and then release it. If you notice already a beginning like a slowness in the return to the original position, yun na, may sign na ng beginning skin laxity na. Naku, meron na. Ayan, I noticed na medyo slow na yung return dun sa original position. We call this like a snap test here. Sorry, medyo may pinching lang, Kim, okay? So I have to assess yung elasticity ng skin. So I was sharing with Kim a while ago yung degree of her problem is nandun na sa moderate degree of problem. She's just 23. Okay. So, nandun na doon sa type 2, grade 2 problem. Grade 2 kasi yung tear trough actually nasa mid-pupillary line na. If it's grade 3, it's extending to the palpebromalar region or the so-called palpebromalar groove. Okay? So, we have classification of the severity of the problem. Pwedeng mild, moderate, severe, very severe. So, nandun na tayo sa hindi na nga mild, nandun na sa moderate. So, and when we correct this, of course, we wanted to improve yung moderate, gagawin mild to up to the 0, right? That's why we advise our patients, the earlier you start, the better po. Don't wait for it to become very severe, okay? Because you'll be needing a lot of treatments. You'll be needing more procedures, more sessions for that. So, while we're still at this earlier stage, let's do treatment na po. Okay, so, PDO threads, we've mentioned about that. We already had like episodes about doing PDO threads under the eye region. So, it's the same technique that we will be doing today, plus the kind of the PDO thread that we will use today, the so-called super tornado PDO threads. My entry points will be at the inferolateral section. So, below the lateral canthus, a bit lateral temporal to it. Okay, like for example, like a 1 cm to 1.5 cm lateral to your lateral canthus. Okay, and having lateral nun, okay? So, we cleanse the area, we put on numbing cream. Aside from my numbing cream, I also have the so-called anesthetic vapor, rather cooling vapor, something like that. It's something cold. So, I'll just spray it, close eyes lang, Kim. Okay, so I'll spray on the side. There you go. So, the side will be my entry point. And the entry point, I just inject also with the lidocaine. So, cleanse the area, please disinfect. Okay, there you go. Just a minimal lido here. Entry point here. So, actually, whenever we inject the lido, there's a normal sensation na it kind of sting. Okay lang, Kim? Kaya. And then, on that side there, I'll be making my entry points. So, I'll be using 5 Super Tornado PDO threads. So, I'll need 5 entry points also. Okay? 1, 2, 3, and then a bit lateral to that, 1 and 2. So, expect some bleeding because we have pierced the skin. Okay. So, the areas that I did my entry points, so I have my Super Tornado right now here. I'll insert the first one. So, direct to it perpendicularly and then kind of stretch the skin a bit. And the goal is to reach the so-called subdermal region. We'll just glide it. And we have to reach that medial ligament there. Rather, the medial orbital retaining ligament there. So, I'm on the second one. So, perpendicular and then glide towards the medial orbital retaining ligament. And I'm on the third one, perpendicular again. So, your PDO threads, these are absorbable types of threads, Kim. Okay? So, they absorb in a span of like, it will depend. So, usually we give a range of 6 months to 12 months. Okay? And then this one will stimulate collagen formation in a span of 12 weeks. So, initially, we get a collagen type 3 and then they become collagen type 1 or the so-called denser type of collagen. So, networks of collagen tissues surround your PDO thread. Okay, so this is my last, my fifth Super Tornado PDO thread, and I'm done on the right side. Okay, how was that, Kim? Okay lang.
Okay.
So, let's proceed to the left side. So, we're doing the left side. Okay, I have again the Pain Freeze. It's a cold spray here. Okay, a cryogenic spray. So, wait for it to frost. And then my lidocaine. Inhale, lang, Kim. Okay, this is lidocaine. Actually, this is the one with the sting sensation and a burning sensation. And then I'll make my 5 entry points. Pressure, please. So expect some bleed there because we did some puncturing with our needle. So I make 5 entry points here. And then I'll glide my first super tornado PDO thread towards the medial retaining ligament there. And the plane of insertion is subdermal. So we want to reach as much as possible the subcutaneous layer. Okay, so this is the second one. So our PDO threads also help in brightening the skin area. So aside from rejuvenation, collagen formation, skin tightening and firming, it addresses the problem of this pigmentation under the eye region. Of course, whenever we do our assessment for under eye problems, we also check for any history of allergies. If there are medical issues, we have to also treat the medical problem. Now, structural issues, of course, we manage by a structural treatment. So, non-surgical approach or surgical approach can be done. Of course, for the young ones, they prefer to start with the non-surgical approach. So, I'm done. We did the so-called PDO threads for the under eye region. We'll show the result to Kim when CSA Medical Aesthetics returns. And we're back. We'll now show the result to Kim. So Kim, here's the mirror. You can check now, okay? There you go. Yeah,
Wow.
right. So actually, you can see already an instant result after doing those PDO threads. The type of threads we use are the multiple filament types of threads or the braided types of threads. They're not the single filament only or like a plain single strand in one cannula. They're made of like super tornado types or coiled types of mono PDO filaments. And we place them subdermally in the layer where we need to restore volume, in the layer we need to also regenerate your fibroblast cells for them to make new collagen and elastin and restore that rejuvenated skin. So Kim, comments.
Grabe no. I really love it po. Sa totoo lang, goodbye ano na po ako.
Goodbye dark
tired-looking eyes.
Tired-looking eyes,
And
yeah.
goodbye concealer na po. Di ba,
Yes,
Doc, remember
right.
po last week sinabi ko na ang
Yeah.
gusto ko ma-achieve po yung hindi na ako magka-concealer, mag-makeup.
Right,
ganun.
yeah, correct.
Ngayon, actually ngayon pa lang po, right after the procedure,
Yeah.
parang feeling ko kahit hindi na nga po ako
Right,
mag-consider po. Kasi
correct.
talagang nakaangat na po siya.
Correct. We can see an instant result after inserting those PDO types of threads. Actually, even if like you had done a filler in the past, you can still combine it with your PDO threads, okay? There are times we just do PDO threads only, and there are times we just do the hyaluronic filler treatment only, okay? For Liana, we did in the past a filler, and right now we combine it with the PDO threads because she needs more of that restoration, regeneration, and the PDO threads are more of the regenerative type of treatment. Okay, so instant result. How about during the process? What's the experience?
It's painless. Actually, mas na-feel ko pa yung
Anesthesia.
cold spray.
Yung cold spray.
Yung cold
yeah.
spray po, yes. Parang mas
But it's
na-feel
okay.
ko,
The cold spray is just fine.
Opo, yun
Yeah.
nga po. Parang mas ma-feel mo pa yung water na
Yeah.
mag-wisik lang.
So for the entire treatment while we were inserting the
Wala
PDO,
talaga.
okay. So we could say it's painless.
Yes, painless.
So instant, painless, natural looking, very safe. It's really effective. Okay.
Yes, wala ding iwang sugat. Ganun,
Correct.
Marka.
Yeah. Others are concerned about that. If there will be a wound, an open wound, it's just like a puncture point. In a little while, that will also close. Instantly, it will close actually. Okay. And then, like few days, some will have like red marks lang. And then after that, it's gonna clear as if nothing was done there. Nothing was poked there. Okay. And then usually we just advise like the entry point, you just apply topical antibacterial at the entry point. And then in terms of your activities, avoid strenuous exercises muna, okay? No heavy weightlifting, okay? And then also like, yeah, rest for the day. And then other ladies are asking, Doc, can I put makeup later on na? Well, in the area where we did some insertion points, avoid muna, okay? Then the following day, it's fine already. And then others are asking, Doc, may bawal kang kainin. Okay, just avoid malalansa muna. And you can come back in a week or two to check again on the healing, especially on the insertion points. Okay? So, I could say like minimal to no downtime at all. So, it's a quick procedure, an easy technique, safe one, and we can see an instant result. And over time, you'll expect some more improvements. Because the threads are working in 12 weeks time, they will still induce collagenesis and further improvements in the texture of the skin in the under eye region. So, pwede na siyang walang concealer.
Yes.
Okay. Goodbye to concealers. Okay. And by the way, Kim, others are asking, why non-surgical rather than surgical? What's your comment on that?
Kagaya pa ng sinabi natin earlier,
Yeah.
it's painless at saka instant yung effect. Tapos sobrang bilis pa ng procedure.
Yes. Especially, she's always busy. She's working a lot. Okay. I can seldom see Kim.
Okay. After ng procedure, pwede ka nang gumala or pumasok agad sa work.
Yeah. You can even go back to your work.
Tama.
Yeah. So, it can be a lunchtime treatment. It's just a quick procedure. Okay. Thank you so much, Kim. For those who have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. If you also want to ask Kim about this treatment, her experience, and also the results, like they want to know, oh, Kim, effective ba talaga?
Yes.
Ano lang nangyari? So, can they like send you like an inquiry sa Instagram?
Yes po, you can message me on my Instagram po at Kim Liana DP, and Facebook account po is Kim Liana, Leana.
Very good. Thank you, Kim.
Thank you so
Kahit
much.
lang, ano lang po Do not ask other questions aside from the treatment. Yeah, joke. Okay. And those who want to know where our location is, we are here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please also watch our other episodes, our other videos. Just look for Contessa Salvador at the YouTube. Okay, yan. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.